All right. Well, good morning, everyone.
Good morning.
Oh, no. That wasn't good enough. We're all here in person. It's a good morning. Got to rejoice in the day that we have. So let me try that one more time. Good morning.
Good morning.
All right, great. Well, if it's hard to follow the superintendent, I think it's even harder to follow the superintendent and your boss at the Southwest Regional Office, Mr. Bill Ludwig. So I'm going to try to do my best and give you a little bit more information, a little bit more meat into what we're doing here at USDA. I do want to thank Judy and all of Louisiana Department of Education for inviting USDA here and setting up this meeting, as well as, of course, Pennington Biomedical Research Center for hosting it. It's a great partnership. I think it's a valuable, very, very valuable lesson and a topic to start discussing and making sure we're addressing obesity. Obesity specifically, not just nutrition, not just child health, but obesity specifically, because it is an acute disease that we need to start talking about in a very specific terms. One of the things that and Mr. Ludwig had said this before, is that one of the things we're trying to focus on is nutrition. And what does that mean for us, right? Nutrition for us at USDA is replacing bad calories with good food items, right? And so what we found is that a lot of children are, and adults as well, right? The American culture eats a lot of quantity of food. And so when we eat a lot of quantity of food, if we put those poor nutrient deficient foods in our body, that's what giving us a lot of calorie and putting us into a state of overweight or obesity. So we need to focus more on replacing those food items, the quantity of food items, with healthy, nutritious food items. And so that's what we're trying to focus here at USDA. We've renamed so many of our programs. We've focused our programs really on better nutrition, better quality foods. We renamed the food stamp program the Supplemental Nutrition Assistance Program. And so that's really what we're focusing on. So it's really wonderful to see so many of us prioritizing child nutrition in a different way through local programs, government initiatives, as well as medical and a health lens. So I want to start off just by saying thank you. Now, children and families and communities have certainly weathered many challenges across Louisiana over the last 2 years. The pandemic has really put us even in a worse state than we were already trending towards in terms of obesity and child nutrition. And I know that the speaker after me, I want to say Dr. Ihuama, I hope I didn't mispronounce your name, ma'am, is going to give you very specific information on how the pandemic impacted children and child obesity. But I think it's very clear to all of us that, even as adults, myself included, when that pandemic hit and I was sitting at home, I snacked a lot. We all were just sitting at home and you just snack. It's just right there in your kitchen. You're snacking, you're eating more poor quality foods than you needed to. Our children were doing the same thing. And that's really put us in a deficit that we need to try and address. So I believe that schools are the very backbone of our community and really have a great place to address a lot of these concerns. They're critical in every aspect of child development, whether it be cognitive, developmental, or interpersonal development. These are the things that USDA is stressing for the current and the future health of our children. So we talked a little bit about how the White House Conference on Hunger and Nutrition occurred yesterday. We have some initial starting points that will, in the future, become our priorities over the next several years. Additionally, a few months ago, our USDA Secretary, Mr. Tom Vilsack, set out a vision for USDA as a leader in nutrition security. Understanding and improving nutrition security is essential to us to address the stunning human and economic cost of diet-related disease. And at FNS, many of our nutrition priorities are focused on children. So while we've made great strides in this area over a number of years, my focus today is really on the key areas of where our worlds intersect, which is child nutrition programs, and we know the incredible value of these programs. Thanks to the immense contribution of school nutrition professionals, administrators, teachers, health professionals that are here today, we've been able to strengthen school nutrition through the school breakfast program and school lunch program. Research shows that American children get their healthiest meals at school. And USDA's nutrition programs meet 30 million children every day. So for many kids, school breakfast and lunch make up over half of what they eat every day. And USDA has found that school meals become significantly more nutritious as we've updated nutrition standards. These nutrition standards we updated through the Healthy Hunger-Free Kids Act in 2010, implemented in 2012, and now through our research we're finding that the meals themselves are more nutritious, and the diets of children who eat at school breakfast and school lunch are more nutritious as well. And those gains have been seen across socioeconomic, racial, and ethnic levels all across the board. And we know this access to nutrition meals makes a meaningful difference both in the health and lives of children, and they also excel in the classroom. So schools that serve healthier meals, that is, those schools that are on the school lunch program and school breakfast program and have good participation, see that their school attendance rates increase by over 10%. It supports attendance, it supports academic achievement, it reduces trips to the school nurse, and it reduces sick days. Now, this is because we're building stronger bodies and helping to feed the brain as well. So it should not be a surprise that we are so committed to the improvement of school meals. Now, earlier this year, USDA published a final rule that set straightforward interim standards for the specific school meal requirements that have been in flux over the past several years. This is what we call our bridge rule, and this provides clarity for the next 2 years as USDA engages with stakeholders, school operators, medical professionals to determine what child nutrition should look like over the long term. Now, USDA is committed to using this next 2 years to develop a science-based meal standard, standards that are ambitious, that are achievable and durable. You can have the greatest intent with a school nutrition program or a nutritious diet, but if it's not durable, if it's not achievable, if it's not realistic, it's not going to be followed. And so that's what we have to weigh the science with what can be achievable. So we've been speaking extensively with school nutrition professionals and other stakeholders to develop these rules in a way that we can identify the tools and resources, help to train school professionals, help to train state agencies to achieve those goals. Now, we realize it's not easy to change eating habits overnight, and that our nation's schools face a lot of hurdles to advancing nutrition, and the future payoffs tend to be incremental, right? Small changes over each year. But we're confident that school operators will be able to rise to the occasion and ensure that children receive the highest level of nutrition possible. So we have this clear vision of what we are dealing with and the acute challenges, and we are very grateful to schools that they have been open, they're receiving children back into schools, that they're teaching them in person, and that they're feeding them in person. But schools continue to face a lot of challenges, and so we have to help with those challenges. One of the challenges is just rising food costs, right? Inflation is everywhere. Food costs have increased considerably. Labor shortages, that's a major thing all businesses are facing, and schools are probably facing it even more because they cannot compete with the private sector with paying their folks to serve the kitchens, right, to work in the kitchens. So labor shortages is a major issue that we're trying to help address. And then, of course, just schools not being able to get the food and supplies that they need. The supply chain issues, along with inflationary issues, are affecting schools quite a bit. So we're doing everything we can to help schools achieve the opportunities that they need to procure healthy food items and have the people to serve those healthy food items. Now, so I'll talk to you a little bit about how we're doing that. So during the past school year, programs had significant tools to deal with these challenges, and they were able to operate universal school feeding programs. That's over the last 2 years during the pandemic. Universal breakfast, universal lunch, summer programs. We were able to feed all children essentially without them paying for it. That ended on June 30th, and so we would have gone back to our normal operations were it not for Congress and President Biden signing the Keep Kids Fed Act. That act allowed us to help schools with the flexibilities they need over the next year, and include options where grab and go, parent pickup could be continued to be utilized where needed, where schools were closed or there were other issues. These are very important. Inclusive of that is the increase in the reimbursement for every meal. This critical new law provides new funding for National School Lunch Program, School Breakfast Program, as well as the Child and Adult Care Food Program, CACFP. The law also partially extends USDA's authority to issue nationwide waivers according to USDA's greater flexibility to respond to child needs. Now, we also recognize that that alone can't suffice for the shock in the system that we had over the course of the pandemic. So recognizing that schools needed additional support, USDA also recently announced $1 billion for schools to purchase American-grown foods through what we call the Supply Chain Assistance Fund. This is on top of the $1 billion that we provided in 2021. So over the last 2 years, we've provided $2 billion in funds, or will have provided $2 billion in funds to address specifically school nutrition supply chain assistance issues. And we're gonna do that through a two-prong approach, one by giving funds directly to schools, and then also by purchasing foods from American farmers, produce and fresh food items from American farmers, and providing it directly to schools. But of course, funding alone cannot address all of the concerns that schools have to operate. We recognize that going back to taking applications at the schools is going to cause a shock to the system as well. After 2 years of not taking applications, that's going to be a difficult thing that schools have to address. Not only does it add administrative burden on the school staff and families, it presents very real risk of what we call the unpaid meal balances or unpaid meal charges that schools start to accrue. So as this situation presents a challenge on a day-to-day basis, no one wants children to feel ashamed for getting a meal. And most importantly, school food directors, school staff don't want those children to feel ashamed or go without a meal. So they're continuing to bear the cost of providing a nutritious meal. And so we want to underscore the need for nutrition programs at every level, whether it be Congress, USDA, or state and local levels to address this issue. And we are encouraging states to continue to look at the opportunities to provide meals for all meals, non-reimbursed, as free meals for all children in some context, whether that be through Provision 1, Provision 2, or community eligibility provision. Some states are even using their pandemic level funds to put towards schools to be able to address these needs to provide meals to all children at no cost. So for instance, Vermont and Nevada and California have all provided meal funding towards school districts to be able to achieve that. Like I said, community eligibility program this year has the opportunity to address the need to provide all nutritious meals to all children. So for the food service directors and school staff that are here, please look into community eligibility program. We've pushed back the dates to apply for community eligibility program, which is CEP, and we are hoping that more schools will apply. Keep in mind that every child gets a reimbursable meal. There is then and at no cost. Then that reduces the stigma of participating in the program. And when participation increases, so does support and the viability of the school meals program. So I'm also aware that many parishes here in Louisiana have lingering concerns about the free and reduced price data that comes from the meal applications when they apply to these programs such as CEP and Provision 1 and Provision 2. So I can assure you that there are a number of paths forward to get that data through our coordination with the Department of Education and other federal agencies. We can still find a way to get you the data you need to continue to fulfill the requirements that you need for that data, whether that be state or local reasons. And we're happy to work with you in any way. Feel free to contact our office on that. So another important consideration for this new school year is the school meal pattern and what foods are actually in the meal pattern. Right now we're talking about specific nutritional diets, right? And as you may know, in February of this year, USDA published a final rule establishing transition standards for milk, whole grains, and sodium. We call it a final rule, but it's actually a transition rule for the next 2 years. So it's effective this school year, 22-23, as well as next year, 23-24 school year. And these transition standards are intended to provide schools with near-term certainty as they transition to standard program operations. So without this rule, the schools would have had to go back to the stricter nutrition standards that were enacted in 2012. With this, we're giving continued flexibility over the next 2 years as we try to help industry produce food items that can meet those new standards, and then also work with school professionals to meet the needs of cooking and establishing meal items that can meet those standards. So for the next 2 years, we're going to use our time to work towards long-term nutrition standards that are science-based and consistent with the goals of the most recent dietary guidelines, as well as health professionals and the Institute of Medicine. So just a quick summary on the standards. So milk operations will continue to be allowed for low-fat milk and for flavored low-fat milk. We're extending the Smart Snack rules for both CACFP and the Special Milk Program. And then whole grains, 80% of all whole grains should be offered weekly, must be whole grain rich. So 80% of all that's offered for the week should be whole grain rich. The remaining grains must be just enriched. Now, sodium is the real target that everyone's really concerned with, right? And sodium, of course, has the effects, and the health professionals here can speak to it better than I can, of hypertension. And so we really want to find a way to bring sodium down across the American diet, but it starts really with children not being in a position where they are used to a high sodium diet. And so for our first target for school year 22-23 is going to remain at that target 1 level, and then we're going to move towards a target 1A in 23-24 in the following year. So we're not going to that second target level yet until we get to 2 years out and we can get a better handle on what the industry or food suppliers can provide to school programs. Now, switching gears, there has been a lot of school closures. So how have USDA and state agencies and schools addressed this? Well, what we've done during the pandemic is to provide what we call the Pandemic EBT program, or PEBT program, which helped provide food buying benefits to families with children that have missed meals during the pandemic due to school closures. USDA increased the daily benefits amounts by 16% to provide a family with 3 children up to $50 more in this program. And PEBT also helped fill the nutrition gap throughout the summer of 2021, providing a total of $12 billion in benefits. We have also understood that schools and CACFP operators needed funding throughout the pandemic to assist their business side of the program. They lost a lot of revenue. And so we provided a $1.5 billion in funding through what we call the Emergency Operation Cost Program. This helped defray some of the costs and some of the loss of revenue over the pandemic. Additionally, USDA has increased the amount of food it directly purchased from farmers through what we call the USDA Foods Program. This is USDA Foods to Schools, and we have increased that by another $1 billion, and it constituted up to 20% of the meals that were provided to school children. Now, we're not only just setting guidance or making rules or providing funding for nutritious meals, we're also trying to advocate, educate, and build the next generation of providers for nutritious meals. And one of those initiatives that we've taken is called Team Nutrition. And this supports both schools and CACFP by developing nutrition education resources to help children. It also provides training and technical assistance to child nutrition professionals, as well as providing technical resources to help to provide a healthy and supportive environment for schools and child care centers, as well as summer centers. Another fun initiative USDA is in the collaboration with the Institute of Child Nutrition in promoting what we call the Child Nutrition Recipe Box. And the Recipe Box provides child nutrition program operators with recipes to prepare healthy and delicious meals that meet the meal pattern requirement. And you can find this on the ICN website. Now, the school setting is the bedrock for child nutrition. But as the superintendent said, children are really only in school only 8 hours a day. And so how do we maximize that amount of time to both let them exercise, have them have nutritious meals, and also get them fed? That's what we do in the National School Lunch Program, School Breakfast Program. But that's only 8 hours a day for approximately 180 days a year. The remaining time, those school-aged children are either at home or in a child care setting. And then outside of school in the summertime, they are not accessing school meals at all. So we also have child care centers and the summer food service program, as well as the seamless summer option, which are very important and critical to the child's needs, preschool children and school-aged children. Summer meals are critical in the lives of millions of children in this country. It increases food security where children are food insecure. And this is on top of course, the school lunch program. Now, Congress and President Biden both recognize that we couldn't do this through school alone. So they have provided additional funding through the Keep Kids Fed Act to provide additional reimbursements to CACFP, as well as also helping family daycare homes to receive additional reimbursement by addressing all family daycare homes as Tier 1 homes. Now, USDA recognizes that ensuring children receive nutritious meals also means through the Summer Food Service Program. What we have done is we have enacted a new rule that codifies important aspects of the Summer Food Service Program so that operators can continue to provide nutritious meals. So on September 19th of this year, a new rule came into effect that will ensure the quality of summer food service operators. It will improve monitoring and provide additional flexibilities in the Summer Food Service Program to make sure that kids are receiving food that they need, they're consuming nutritious meals in the time and place where that they can receive it. USDA does also want to reward those operators that are providing good nutritious meals, who prioritize nutritious meals. And so we've created an award system called the Turn Up a Beat Award. And that award recognizes outstanding summer meal program operators across the nation who work hard to offer high quality meals that are appetizing and nutritious. The Turn Up the Beat Award was created to showcase those sponsors and to highlight them. In 2021, FNS awarded 84 summer meal sponsors with that Turn Up the Beat Award, and we encourage your state and your local operators to focus on how you can be an awardee as well. You can find that on the Louisiana Fit Kids website as well as USDA's website. Now, together we have a long road ahead. There's quite a bit that we are trying to do now, but more that has to come, and this is a continuous fight that we need to take with each other to address obesity, address nutrition needs, and all your extra support and flexibility is very helpful. So let me just wrap up this morning by saying that I'm asking not only the child nutrition operators, but the state and medical professionals to continue to push forward this information, to focus on obesity, to focus on nutrition, and find ways and solutions that work best for Louisiana, and let USDA know what works best for Louisiana. Let USDA know what are your successes, what your needs are, so that we can incorporate it into our programs, into our guidance, into our rules. So thank you again for having me here today, and I hope you enjoy the rest of your conference.